The purpose of this presentation is before starting the teaching learning of pharmacology, I just first give you the overview of the pharmacology subject, and there are different components in the theory as well as the practical part in pharmacology. First we will discuss about the theory portion. Now in the theory there are, if we want to divide the pharmacology, it is divided into the two parts. One is the general pharmacology and second is the systemic pharmacology. Now, in the general pharmacology, it is a very essential. You can say that it is a platform or the pillar for understanding the pharmacology because it encompasses the various basic definitions, terminologies in the pharmacology, then nomenclature, different nomenclatures that you will encounter repeatedly throughout the teaching learning of pharmacology. Then what are the sources of the drugs? Then how? You all know that pharmacology means the study of the drugs, but which are the different routes of the drug administration? What are the advantages? What are the disadvantages? In which condition which route should be used? All these will be discussed in general pharmacology. And if you just, even if you don't know anything, you just think that if the two components that come in this second MBBS pharmacology, these are what the body does to the drug and what the drug does to the body. So, what the body does to the drug, that is pharmacokinetics, and what the drug does to the body, that is pharmacodynamics. Okay, so these are the two hands of the pharmacology, we can say. Then different adverse drug reactions. So all these are very basic topics which are very helpful to understand the overall pharmacology subject, and these we are going to start from tomorrow's lecture sessions. Okay. Now, systemic pharmacology. In the first year, you have learned about the different systems. Now, in this year, in pharmacology, you will learn about the drugs that are to be used in the disorders of the different systems. Okay, you all know the system. I am just revising it: autonomic nervous system, cardiovascular system, respiratory system, gastrointestinal system, central nervous system, and peripheral nervous system, autocoids, blood, endocrine system, and yes, a major chunk. That's why I have written in the capital that if you just look at the diseases right now prevalent in the society, there are major part consist of, one is the lifestyle disorder and second is the infectious disease. So for the treatment of the infectious disease, the drugs that we are used is the drugs that kill or inhibit the growth of the microorganism, and that will come under the heading of chemotherapy. Okay, and certain miscellaneous topics. So in theory we will learn about the two major subject headings, that is general pharmacology and systemic pharmacology. Okay. Now in the pharmacology practicals, this practical is divided into the four major headings. First is the clinical pharmacy, in which you will learn about the different dosage forms, different routes of the drug administration, different devices, dosage calculation, how to set up the drip and all that. This all you will learn in clinical pharmacy. Then experimental pharmacology. In this you will learn about what is the effect on the vital parameters, okay, of a human being in case if you administer the drug, okay. And these we will learn with the help of the cal software. Then clinical pharmacology. Here you will evaluate, you will know about the different prescriptions. Okay. If any patient comes to the physician diagnose the condition and then write the prescription. So how to write the prescription, then which are the components of the prescription, then various fixed dose combinations available in the market, evaluation of these FDCs, then selection of the P drug, then evaluation of the drug promotional literature. So all the clinical aspects of the pharmacology it will be taught in this clinical pharmacology section. Okay. And last but not least, how to communicate with the patient. Communication in terms of if you have advised the patient to take the ORS, how you will communicate. Okay, suppose you have advised the patient to take the this drug through meter dose inhaler. Which instruction will you give to the patient? Which instruction will you give to the patient for the administration of the suppository, for the eye drops, ear drops? Okay, all this will come under the communication skills. Okay. And I here again I want to clarify that in experimental pharmacology we are not doing the experiments on the animals, we are just discussing and observing the experimental graphs, what are the effects of the drugs. Say for example there are certain drugs that we are administering topically in the eye, so just we will look at what is the effect of this drug on the pupillary size, light reflex, with the help of the computer assisted learning software. Okay. So these are the major components of the pharmacology practicals. Fine. So from tomorrow onwards, we will start up with the definitions, terminologies, and nomenclature. Thank you.